Thanks very much, everybody. And every Thursday, the Deputy First Minister and I stand here and reflect on deaths caused by COVID-19 that have taken place. And I want to begin today by referring to someone very dear to me who has, after a long battle with cancer, passed away, and that's of course my former colleague Jimmy Spratt, who passed away this morning. And when devolution returned to Northern Ireland in 2007 after the St Andrews Agreement, I sat beside Jimmy in that now famous photograph in the Long Gallery when Dr Paisley sat down with the leadership of Sinn Féin for the first time. And I mention that because Jimmy, like me, believed very much in building a shared future. So he wanted everyone here to feel at home in Northern Ireland, and he wanted to make devolution work. And he never shied away from the challenge of trying to keep Northern Ireland moving in the right direction, and I just wanted to acknowledge that today. I will miss him and his quiet, determined support, but it was comforting for me and indeed for my DUP colleagues that the comments of ministers from all of the other parties today at our executive meeting reflected Jimmy's qualities and the contribution that he had made to politics here in Northern Ireland. So to Linda, to his sons of whom he was so proud, to his daughters-in-law and to his precious grandchildren, I send my love and my deepest sympathy. Ministers discussed the latest progress with the COVID virus this afternoon, and I'm pleased to say that today we have had further positive news in relation to transmission levels of the virus. We are continuing to keep the R rate for cases at well below 1 this week. It's between 0.65 and 0.75. And the case positivity rate is down to 5% and falling, pointing to the epidemic coming back under control. And we're seeing quite a dramatic fall in the number of people testing positive for the virus. I want to take a moment to reflect on this significant achievement, because just over 2 months ago, on the highest day for reported cases, 2,315 people tested positive for the virus. The figure from today's dashboard is 163. And the pressure on our hospitals are thankfully gradually easing. The number of COVID patients in ICU departments have dropped below 30. And I do welcome the news today that there will soon be a scaling up of high priority surgery and a rebuilding of elective care services at Belfast City Hospital as the Nightingale facility is stepped down. These advances are due to a number of factors. There's no doubt that the everyday actions of our citizens have helped save lives, and we are grateful for the many sacrifices people have made. But I've always said that lockdowns cannot be our only option to control this virus. Over this last year, we have worked hard on a four-nations basis to roll out new and effective treatments, efficient test and track system, and of course successful vaccination programmes. And I'm pleased to see the continued extension of asymptomatic testing across public, private and local government sectors, and this is key to identifying and containing localised outbreaks. Our vaccines programme is accelerating. It's currently in stage 3, which is significantly ahead of schedule. And by the end of this month, the SSE Arena will have the capacity to provide 40,000 vaccines per week, in addition to the ongoing work in regional centres and GP surgeries. Over the course of today, the number of people in Northern Ireland who have received the first dose protection will pass 600,000 marks, and this is another significant, very welcoming and encouraging milestone. It's not merely a statistic, but it's reassurance for our grandparents, mums and dads and sons and daughters across our community. The proportion of new hospital admissions with COVID-19 aged 80 or over has reduced from approximately 40% to around 20%, suggesting that the vaccine programme is having a real impact protecting older people. Now, there is no doubt that this has been a difficult year for all of us, and the individual actions of citizens have been key to us gaining control of the virus. But we're now at the point where we can have the confidence to begin to lift that burden from your shoulders. And next week we will see the start of a phased return for our school children, and we will assess the impact of this at the next executive review on March the 16th as we step forward along our pathway to easing restrictions. I'm fully aware of the frustration that many, particularly businesses, feel at this point that we have not been able to lay out a full-scale timetable for opening up our society. I feel that too. But there will be an ongoing and active assessment of a wide range of data and indicators. Economic, education and community indicators will be part of executive decision making, as well as the health data comprising issues such as isolation, emotional well-being, economic performance, business vulnerability and education impacts. And of course, restrictions may only remain as long as they can be demonstrated to be proportionate and necessary. So our early focus will be on education, the family and outdoor activities as we start out on the road back towards normality. It is welcome news that the current health indicators are positive, and of course we have the benefit now in the weeks ahead of having the seasons with us as well. So the journey over this last year has been so very difficult for so many of us, but both literally as well as figuratively, the brighter and better days are now within our grasp.